Glaucoma and eye care home. Eye care and eye care home. Glaucoma is a terrible blinding disease that is frequently associated with an elevated pressure in the eye. There's actually multiple reasons why someone can have glaucomatous optic nerve atrophy and sight loss. Traditionally, it's because the pressure in the eye that should be at a certain range is higher, and too high of a pressure in the eye reduces circulation and affects all aspects of the eye, especially the optic nerve. And if you don't get if you have too much pressure in there, fluids don't flow, and the exoplasm and all these ischemic problems happen. So another thing that we focus a lot on in the office is the fact that glaucoma can happen with low pressures, and it's because you have a circulation problem. I'll tell people, it's a crazy analogy, but it works. You know, I can strangle you with pressure, or I can loosely drape a plastic bag over your head. In either way, you die. One is pressure, then you affect things, that things don't circulate, and the other is just a lack of oxygen. So both have to be approached. What we do as eye doctors, and we work from 9 to 5, and so what happens from 5 o'clock to 9 o'clock? I like to say the thief of sight comes at night. And when we're laying down, sleeping all night long, our pressures get higher, and there's a linking to our blood pressure, which drops. And if our blood pressure drops too much, a higher eye pressure, a normal eye pressure, can affect somebody if their blood pressure is too low. So what we want to do, and what the world has been looking for, is a tool to check your pressures, so somebody can go home and check the pressures at night. Studies have been done years and years ago, where people would stay in hotel rooms and they keep them in some place where they wake them up all night long and check their pressures throughout the night, and you get this diurnal curve. And so the higher pressures happen between, if you're waking up at 7 o'clock, somewhere between 5 and 7, and so there's a tool that can be used. Now, initially, this device right here, there's a little probe that goes inside here. We use this in the clinic, in the office. And this is placed on the forehead, and there's a little probe that strikes the eye and bounces back. It's called a piezoelectric sensor. So what happens is the probe goes out at a certain speed, and it comes back depending upon the hardness of the eye, or the pressure in the eye, and it bounces back at the eye, and that reading is captured and converted. And there's a lot of factors that go into that, the stiffness of the cornea and whatnot. But this is a piezoelectric sensor device that we check pressures in the office. Well, the company brilliantly came up with this device here, which the patient takes home, and they can sit here. We rent this thing out for a week. You get, I tell people, I want breakfast, lunch, and dinner right before you go to bed, right when you wake up. And if you happen to get up in the middle of the night and go potty, then check yourself in the middle of the night. But what we'll do is we'll find, in agreement with the studies, that about half of our patients, they are having significantly higher pressures early in the morning, and therefore we have to change our treatments that we give patients to control their glaucoma, to keep that pressure down. So this is placed on the eye, and readings are taken by the patient over a week. And they have another unit that is works out a little better, a little easier. And this unit is used at home for home use. It's all linked to the cloud. It's interesting. Patients buy these if they want to, for the people with brittle glaucoma or people at higher risk who want to do that, and they use it themselves. And we dispense these to patients. So there's an answer for the unknown of what are my pressures after the doctor's office is closed, between 5 p.m. and 8 a.m. And I'm Dr. Wilcox, and love to help you help yourself.